So Chase Feiger is an entrepreneur, also graduated from Mount Sinai, who specializes as an early stage investor and advisor in a number of healthcare enterprise software and consumer companies. He co-founded RX Define, a company that provides telemedicine software that enables consumers to interact directly with doctors via customized apps and websites. He's been featured multiple times in Forbes magazine as a part of their 30 Under 30 series, I guess until you turn 31. Also contributing writer for Forbes. And then, of course, Dean Charney, who is Dean of the Medical School, President for Academic Affairs for the Health System. He is the world expert in neurobiology and treatment of mood and anxiety disorder. He's making fundamental contributions to the understanding of the causes of human anxiety, fear, depression, and the discovery of new treatments for mood and anxiety disorder. So I'll let you take it away. Chase, I guess maybe, do you want to just start with an introduction to your educational background and then how you got to where you are, and then we'll let
Alexis, if it's okay.
Oh yeah.
I'm gonna ask him to start before then. So
sure, perfect.
Chase and I have a great relationship. He's done amazing things, but let's start earlier. Tell the students, where were you born? What was your upbringing like? And then we'll ultimately get to going to medical school. But give a little bit of context of who you are.
Yeah, most definitely. And thank you so much again, Dean Charney. As well as Alexis. I hear a slight echo. I don't know if it's from me or.
Yeah. So everybody should go on mute. So we try to avoid the echo.
Perfect. And then if my audio cuts out, just let me know. I'm happy to dial in through the phone as well, and just use this for video. So yeah, I was born and raised in Dallas, Texas. Again, I'd like to think that, and I'm very thankful that I grew up in a privileged environment where upper middle class family who were able to support me on a variety of different academic endeavors, and through that support, it's really given me the fortunate opportunity to take on significant levels of risk, which is why I've dedicated most of my career to wanting to work in particular with underrepresented minorities and founders who have not had or have not been given the same privileges as me, and I've tried to dedicate as much time doing that. In particular, RX Define, which I'll talk a little bit more about later, help build this company around someone who is, who didn't grow up in the same circumstances as me. So again, I definitely grew up in an environment, and very thankful for it, where I had a lot of these opportunities and options. I ended up going to the University of Pennsylvania for undergrad, and while I was there, several of the professors, I started in 2007, and in 2008, several of the professors that I was working with ended up getting appointed into positions, advisory positions in the Obama administration. And I was able to continue and conduct some really great, interesting work for the administration, in particular around technology, and in the introduction, of course, beyond just health information technologies, but spanning to mobile technologies that were extensions to, and that were building extensions and other applications on top of, or extracting or pushing data back and forth to electronic health record systems, clinical decision support systems. And my job was to really, for several years, measure the impact that these technologies would have on the delivery of patient care, quality, and safety. And that work and research that I did, led me to a role at First Round Capital, which I.
But I'm going to stop you for a minute.
Go ahead.
You're going too fast. So let's back up a little bit. So, let's say when you were in high school, did you know you wanted to get into technology? Did you know you wanted to go to medical school? So, what were you thinking about in high school in terms of what you wanted to do?
Yeah, it's a great question, Charney. In high school, I knew that I wanted to go to medical school, and I was always convinced that I was going to be a practicing physician, in particular, an emergency medicine physician who was going to, business was going to be a part-time thing for me. It was not going to be entrepreneurship, technology was not going to be a full-time thing. My full-time gig would be working as an emergency medicine physician. And then the work that I would do outside of that would involve, of course, technology and maybe some administrative work. So, and that was through high school as well as college. That's actually where my ambitions mainly lied. So that answers your question.
So something changed. So, it's a little bit like what happened, to me, that I spent most of my career being a researcher, but when I was in college, I was supposed to do research as part of my graduation, and actually, I didn't. And then when I went to med school, I wanted to join the Peace Corps and not be a researcher. But things changed. Now, for me, it changed with a role model. That there was somebody I met in med school who I admired, and he was inspiring to me, and that turned my career around. So did you meet a professor or somebody that said, I want to do, it turned the corner for you and said, maybe I'm not going to be like an emergency medicine physician. I'm going to do something different.
Yeah. So those mentors would be folks like John Halamka, who he was formerly the CIO over at Beth Israel Deaconess. I would call him, he was like that perfect hybrid of technologists and, health informatician and emergency medicine doctor, and then completely shifted over to the administrative side. And actually now so he's been a very big role model for me. Several of the people I went to college with. So right place, right time. Once again, when I was an undergrad at Penn, Nat Turner, who is the founder of Flatiron Health, had started a company out of Penn called Invite Media. He has played a major influence in my life. He's actually the one who got me my role at First Round Capital. So he's been very influential in the directions and the decisions that I've made.
And so when did you meet these folks?
I actually, while I was an undergrad at Penn, and then I would say but John Halamka, a lot of the other folks and a lot of the other mentors, Howard Morgan, many others, that was through my work at First Round Capital or in the early days when I started Parsable. So actually, I met most of these people during my first year of medical school or during the leave of absence that Dean Charney was so nice to give me to take on the risks and the opportunities that really paved the way.
So I remember meeting Chase. I think you may have been a first year, and with another student, and they were telling me all the things that they were developing in terms of technology, and I was thinking, he's a first year student. Is he going to class? Is he learning anything about medicine? And he was going to class, but they were doing this stuff at night, and so they had a dual passion. So why don't you describe that a little bit? So you started med school, and then what happened?
Yeah, so I started medical school, and it was coincidental. First Round Capital, this seed-based venture firm, they didn't really have a thesis in investing in early stage healthcare technologies. They were primarily, they were the seed stage investor in companies like Uber, Warby Parker, some very big companies in both the consumer technology, enterprise software space, but they didn't really have a thesis in healthcare investing. So Nat Turner, the founder of Flatiron, introduced me to the partnership there, and they were looking for someone that can help them diligence different deals in the health tech space. I see there are a couple of VCs. I see Sherman's on here, he's got quite a bit of experience too on the venture front. There's some good people in here that have some very good experiences who I think can also serve as tremendous mentors for those interested in the space. But again, it was just through the role I played in the VC in the venture fund. that really opened up a lot of the doors for me, and that was all through introductions and individuals I met along the way.
So you're also learning medicine along the way, and at some point, you decided that you wanted to take a leave of absence, to devote yourself, more full time to being an entrepreneur and developing companies. Why don't you talk about how you made that decision?
Yeah.
And what did you do during that time when you weren't in med school?
Yeah. So again, that was another right place, right time situation. Through first round capital, I met two serial entrepreneurs who became mentors of mine, Ryan Juney and Jan David Ehrlich, or Yonda Ehrlich. They had previously had some successful exits to companies like Google, Qualcomm, LinkedIn, and others. And they were looking for guidance, someone to help them conduct customer development, which, there's a lot of overlapping qualities. We could talk about it later between that and the way that we assess and the way that we think medically. But the idea is going out and understanding the pains and problems of different customers to try to figure out what type of software solution we should be building. And we did that with hospitals. And we did that with a variety of different hospitals, saw a very big opportunity, and that's actually what led to the development of Parsable. So it was first round capital kind of brought me together with these two serial entrepreneurs. They said that they wanted to lead the seed round for the investment, and these two individuals who became very close mentors of mine and obviously co-founders and very close friends is what led to me taking the leave of absence from Mount Sinai.
And then during that time, you formed some companies.
Yep.
Right.
I did. So
and how did that work out?
Yeah. So starting a company, it's really, it's a roller coaster ride. You oftentimes, you'll open up, you'll read a New York Times article, a Forbes article, and it sounds very glorious. It sounds very, it sounds very nice, and it sounds very rewarding. But it is a ride of constant up and downs. When I took the leave of absence from Mount Sinai, I actually have a very vivid memory of when something we were building early on. This is right after I took the leave of absence. My father was still not talking to me because he was upset that he thought I was dropping out of medical school. I was laying in the first round I was laying in Chris Fralick's office, who's one of the partners at First Round Capital. I was just laying right on the floor looking at the ceiling because one of the things that we were trying was just not working at all. And I remember just laying there being like, wow, what kind of decision did I make, leaving Mount Sinai to do this? That occurrence and that feeling or sensation definitely happened way more times than not, especially in the early days. We ended up pivoting. So we pivoted. Parsable was originally known as Wearable Intelligence. At the time, there was a really good why now opportunity to apply wearable technologies such as Google Glass in the enterprise, i.e. enable deskless workers, i.e. doctors, nurses, and others to gain the benefit of this new hardware solution. And we were building the software on top of it. So we had raised money and partnered up, built the first go-to-market plan for Google Glass, for the Google Glass Enterprise, which became known as the Glass at Work program. Raised money from some really nice name brand funds. And, along the way, we realized that there were some challenges we dealt with about 6 months into the company, which led us to pivoting slightly to a different idea. Then about 8 months into the company, it slightly altered even more into a different idea. And we ended up pivoting the company 3 times over the first 1.5 to 2 years of the company. Before ultimately finding what's called product market fit, which I'm happy to get into as the
Okay. So yeah, I just want to remind the students on the Zoom, if you got questions, put them into the chat. So when I stop asking Chase questions, we're going to go to your questions. So so I'm hearing, and I was going to bring this up, that failure is part of the deal. And in fact, I say to our faculty often that if you don't fail, you're not trying hard enough. So you had to deal with failure, and you had to move on from that. But that's what you're describing, correct?
That's right. And it's funny because dealing with failure, we all deal and we all encounter with stress, and this really ties into a lot of the work you've done, Dean Charney, on areas around mental health, because I actually think that mental health is a huge issue for a lot of entrepreneurs. For a ton of people, and it's interesting. We talk about things like resilience. It definitely, just like you get calluses on your hand when you're lifting weights. The more times I dealt with failure, the more times I dealt with a circumstance where it calloused me. It made me more resilient. It made me, stronger. It was dealing with uncomfortable experiences, uncomfortable situations, and being exposed to it. The number of times that I was, it really it made me a lot stronger, and it made me a lot tougher to deal with. So the first time I dealt with it, it was very challenging. Like, that was probably the most stressful. Then I dealt with it again, and it was still very stressful, but a little less stressful. So the more times you deal with these challenges and you learn how to pull yourself out of this hole, the stronger and the more resilient you get.
Yeah. That's really important. Some of the quotes that I use often, Oscar Wilde said, the hardest wood is that burnt by fire. So the key is to learn from each failure and not give up. So at some point you decide, okay, I'm going to go back to med school. So how did you make that decision, and then what happened?
Yeah, I decided to come back to med school again, thanks to Dean Charney, Dean Bowler, and really the rest of the Icahn School of Medicine administration, who gave me this opportunity. I don't know any school that would have given me the time and would have actually valued the work that I was doing as an entrepreneur. So again, thank you. It wasn't.
By the way, any student who's thinking of taking a leave to do what he did, no problem. I'll grant it.
So
he's not the exception.
So I decided to, I came back to medical school after we had found product market fit. So it was after we raised our Series B in financing, and we were around, I want to say, around $7.5 million in annual recurring revenue, which is a term to kind of describe. We were selling a SaaS, software as a service solution, to large enterprise. So it was when we reached that point that I, decided most of the efforts at this point was just going to be, there were so many customers pulling at the type of solution that we were building that it was more about just growing and scaling what we had already done. And so the amount of individual contributing work I had to do greatly diminished, because I was able to outsource and delegate so much of that to other individuals at that point in time. And yeah, I was able to, I returned back to medical school. Now, it was a weird gap. I did it between my first and second year. I took, it was actually 3 years off between my first and second year. So, again, coming back to second year of medical school, if you're going to do it, by the way, my advice is do it later. Don't do it between your first and second years. Sometimes you can't actually, sometimes the timing happens at the oddest circumstances, but my advice would be to do it after. It was definitely, it was crazy. I actually spent 6 months before coming back to medical school. I was watching Pathoma, I was starting board study, I was reviewing everything, microbiology, everything that we had done my first year, just to refamiliarize myself on how to study and how to learn. So it definitely required a lot of independent work, but again, I'm so thankful I came back and finished.
So you did the third year, and then you graduated. And what was, I'm going to ask you what you're doing now, but before that, why did you want to go back to med school? What was the value of becoming a physician in terms of your life's goals?
I knew that most of the work that I wanted to do within the space was going to involve healthcare. And I wanted to be able to speak the language of medicine. I wanted to be able to understand the language of medicine. and this is pre this whole digital health boom of COVID. I mean, no one ever predicted that we would be dealing with this global pandemic. Well, I shouldn't say no one. There were a couple people who predicted we would be hitting a pandemic. But again, I just knew that I wanted to build and invest in companies in healthcare. And even during medical school, when I returned, everything from health information technology companies. I mean, 60% of the investments I've made have been in healthcare companies, whether it's solutions for payers, health systems, pharmaceutical manufacturers, medical device companies, and to diligence and to really understand how these technologies work and to understand the value of these technologies. I would say that having the medical degree is more valuable than having any other degree imaginable. If you want to do anything that involves healthcare and business, and even if you don't want to practice, the medical degree to me is absolutely essential. It's essential.
So you graduate, and why don't you describe what you're doing now, and also related to that, how has the pandemic affected all that?
Yeah. So I've been following trends for really the last 10 years around this idea of the consumerization of healthcare, i.e., we've seen so much progress around how food delivery through applications, obviously like Seamless, DoorDash, Postmates. We've seen the consumerization of the fact that you could just easily switch on your computer, watch a movie on Amazon or Hulu or Netflix. And so the question that continued to revolve in my mind was when is this going to come to healthcare? When is this going to come to healthcare? And again, just very closely following those trends, we saw the rise of companies. One of my friends in undergrad had started a company called Hims and Hers, which centered around this idea of consumerization of health. Another friend of mine had started a company called Roman or Row. And so I saw the emergence of so much of what was happening in consumerization of health. And one of the ideas that I had was, combining my experience in enterprise, how are pharmaceutical manufacturers thinking about this when it comes down to new distribution methods, the way that, and how are they exploring new ways of lowering cost of medication by not having to go through, big distributors like McKesson or Cardinal? How are they thinking about new models that may circumvent the PBMs? And that's ultimately what led to RX Define, the company that I started.
Has the pandemic been an opportunity for what you're developing, or has it slowed things down for you? Yeah,
it's definitely been an accelerator. Again, being in telemedicine and telehealth, there were already so many regulatory changes that took place really between 2016 onwards. We saw so many states passing new regulatory policies, loosening restrictions around things like telemedicine. We saw, the Center of Medicare Medicaid allowing for reimbursement for things like, remote patient monitoring. So we've seen a lot of, I'll just call it, the regulatory change resulted in really a tidal wave of adoption, and this led to the emergence of a lot of some of the companies I previously described. The pandemic created the accelerator. If that was a tidal wave, the pandemic created a tsunami of adoption within the space. Again, you've seen even companies, publicly held companies like Teladoc, who their market cap more than 5x during the pandemic. It's been truly tremendous for digital health as a whole.
Great. So I'm going to turn it over to Alexis. I hope you have questions for Chase. And if any of you, I'm serious when I say, if any of you are entrepreneurs and you got ideas, the school wants to foster that. We want to help you be an entrepreneur, an innovator, to change medicine. And whether it's a discovery of a new medicine, a new digital approach to healthcare, we're all in to help you. So, Alexis, I'm going to hand it over to you to take questions from the students and address it to Chase.
Okay, yeah, Chase, it looks like you have a few questions here. So, start. So from Connor, how do you navigate the balance of accepting failure, like reworking or rethinking your idea versus staying true to your own vision because you're sure that it'll work even if others are skeptical?
Such a good question. Oh my gosh. I'm not just saying that. I can't tell you, Connor, the number of times, there is a spectrum between, listening to what the market says and then having a certain amount of conviction and being able to run through walls to create that change. Wow. I mean, the number of times I've had that thought, even over the last 2 years for portfolio companies, probably once a week. Are we giving up too early? Do we not have enough conviction in this idea? So I'll take a step back. Product market, when we think about market pull, there are some ideas out there right now where market timing is so perfect. You can take an entrepreneur who I would call is not an A-level entrepreneur, i.e. not a tier 1 entrepreneur, tier 2, but just just someone who happens to be in the right market at the right time, and they happen to pick the right idea, and when they have product market fit, they just can't even keep up with the demand that they're experiencing. I've seen that with portfolio companies, founders that I've invested in, companies like Masterclass and others, where pull has just been absolutely incredible. That is the exception, not the rule. As an entrepreneur, I've never once experienced the sensation of a market pulling me so hard in a direction that it's just an absolute no-brainer. And oh my gosh, kumbaya, we found product market fit. So it's a spectrum. You really do need to have a certain amount of, conviction, and it needs to align with some of the signals and indicators that the market is giving you. The thing I like to think about is really the why now. Why is this company, what are the market pulls, or what are the market forces that are supporting whatever company you're building now? In healthcare, a lot of those forces center around regulatory change. When there is any type of regulatory change that takes place, that creates entirely new market opportunities for entrepreneurs in healthcare. That, if you're thinking about building a company and you're thinking about building it in healthcare, my advice is look at those regulatory changes, because those are going to create the market forces you need. And if you have conviction around a certain idea that fits within that channel, you're more likely to find success. There's some entrepreneurs. I spent a month during the pandemic. I spent a month working out of Park City, Utah, and I took a drive down to this mountain called Topaz Mountain. Again, you guys, you'll enjoy this analogy, Connor, because it fits in with what I'm saying. I wanted to go. It's called rock hounding. I wanted to go mine for gems on this mountain. So I went and bought a bunch of the materials I needed. I bought the picks. I bought the shovels. I was really excited. I was with my co-founder, a couple other colleagues of mine, and we drove several hours to this mountain, Topaz Mountain. It was 108 degrees outside, and we spent hours and hours. And I thought we were going to find, topaz, red beryl, all different types of gems. And I was hammering away on there with my my face shield, my mask, and sweating profusely, trying to stay hydrated. No exaggeration, it was 108 degrees. Couldn't find a single thing. Then we saw a sign that said blast zone. And literally the day before, there was, you were able to pay money, essentially like $15 to go into the blast zone instead of other areas, the free zones around the mountain, to find rock. The blast zone, when we went into the blast zone, we were able to find, things that we spent hours, within seconds, you're finding things left and right. The reason I bring up that analogy is you want to look for the blast zone as an entrepreneur. Sometimes certain inventions, things like, there's certain movers, they say if Steve Jobs and Henry Ford, if you look at like technologies like the iPhone, the iPad, there's certain things where the market's not going to tell you whether or not you're digging in the right direction. But my advice is, if you're building something in healthcare, find the blast zone, and you will require a certain amount of conviction. It's never easy. Even when you're operating in an area where there's there's a lot of there's market pull. You're still going to be dealing with challenges where if you don't have enough conviction, you're going to want to give up. So you really do need to make sure you have a certain amount of conviction. It's really a spectrum. Good question, Connor.
I like that story. Okay, let's see. So the next one from Sherman, thanks for taking the time to share more of your story with us. Can you talk a little bit about finding product market fit outside of the initial hypothesis of healthcare and what it was like to balance how the company grew versus your personal interests in medicine?
Yeah. It's a good question, Sherman. I know you've seen this on the other side as an investor, I'm sure, a number of times. Yeah, I mean, the initial hypothesis that we had around wearable technologies, I had so much conviction. I saw the commercials early on, way before even the beta release of Glass. I saw the commercials of Glass, and ideas were spurring all over my mind. And the thing that I failed to recall or to focus on at the time was the fact that a lot of health systems were still having to fulfill meaningful use requirements. They were still rolling out electronic health record systems. So much of their CapEx and OpEx budgets were going towards these technologies. So even though Google Glass, we were able to get a lot of pilots signed with a number of different health systems, we found ourselves, I call it, in pilot purgatory, where we were, not able to, really get long-term contracts in place, with health systems, because again, they were happy. The first step was making sure they fulfilled those policies, which is very important. So again, this would have been good if I'd focused on, what was actually happening within the market instead of trying to force a solution. We probably could have saved a lot of time. What was coincidental, though, at the time was when an article had come out around the work that we were doing, and the CTO of a company called Schlumberger, who was very focused on how to improve worker safety, how to decrease and diminish workplace injuries, which were a big issue within the industrial sector. They were looking at technologies like Google Glass. So even though our pilots weren't working in healthcare, right off the bat, he said, would you be interested in coming and pitching the technology to myself and the other executive team at Schlumberger, who was our first customer for Parsable? Went down, and when I started shadowing the way that these individuals were doing work. Again, I never thought that I was going to be in these types of environments. I thought we were going to be selling to health systems and hospitals. And I found myself waking up at 4 a.m. going to industrial manufacturing facilities where they're creating downhole tool technologies. I didn't think my dad was going to be very proud either around how it's changing the face of healthcare while, working in these types of facilities. But what I noticed was every single one of these individuals, they were all using paper-based processes and procedures to do their work. I.e., they never even, there was no really, they had ERP systems, which is, the ERP system is the electronic health record equivalent in enterprise, in a lot of these enterprise environments where, the Epic and Allscripts of the world, in the world I was now tinkering in, were companies like SAP and Oracle, if any of you have heard of them. And but everything I noticed, all of the work that the deskless workforce was doing was all on paper. And so, why would they want to bring in wearables? Bringing in wearables, this is a group that had never used desktop computers. They weren't using mobile phones and tablets. So jumping all the way to wearable was a very, very big jump. So it was a careful observation. While the decision makers were pushing wearables, our users, they were some of the later adopters of this solution. And I noticed during their work days, they would pull this out to text their friends, loved ones. And so they were spending more time on this than they were spending on the actual wearable technology. So spending a lot of time with our users, understanding their pains, understanding their problems, matching the pains and problems with the key objectives of the decision makers is what guided us to product market fit. So really, it's just about, if you're able to spend as much time as possible and you understand what those key objectives are, what are the objectives of the decision makers was to They wanted to decrease cost. They wanted to decrease non-productive time. They wanted to make sure people were complying with tasks. They wanted to, digitize and automate. How do we know people are complying with standard operating procedures and standard operating procedures in the workplace? So they thought, technologies like the wearables would enable folks to see step-by-step what to do, and that would enable them to follow it. But we found that listening to the actual users and understanding what they were where the natural forces were pulling them was more focused on this solution. And that's what ultimately helped us find the product market fit. So it's all about just listening, asking questions, spending time with the decision makers at whichever company you're selling to, spending as much time with your users, making sure that the solution you're building is really solving a problem for them. It's just constant investigative work and being willing to fail along the way.
Just to interject for a second before we go to the next question, somewhat ironic that the co-founder of SAP is Hasso Plattner. Hasso Plattner has given Mount Sinai $15 million, and we have formed a new institute, the Hasso Plattner Institute at Mount Sinai for Digital Health. So now SAP, the founder of SAP, who's a multiple billionaire, is investing in Mount Sinai as it relates to digital health. Okay, got another question?
Yeah, we have a couple more. One from Akarsh. So just curious if you'd be able to address something from a founder's perspective. How do you deal with entering a space as a founder and having to refine your product or service repeatedly? And when do you decide now is not the right time or my energy is better spent elsewhere?
Yeah, another very good question. Again, the good thing about, well, first and foremost, my advice is always be willing to put a flag down. We're gonna, the goal of like these ideation brainstorms. So let's just, I want to take ARX Define as an example, right? Because we actually went through this as a company. Things were actually, we were feeling a lot of market pull early on very quickly. We were able to move rapidly. We moved from 0 to $1 million in annual recurring revenue without a product in a period of months, selling to pharma manufacturers. And pharma manufacturers are some of the slowest movers. Now, unfortunately, along the way, we made, we upset would be the right word. We upset a lot of these different channel partners along the way. One of the large wholesalers approached us about an acquisition. We received some threats from other groups who were very upset about the fact that we were trying to cut PBMs out and disintermediate this industry. And ultimately, this pull, like ultimately, some of these stakeholders along the way won. And we sat down and, there were countless times where early on we built an exercise where we create a list of, okay, we built this incredible product for telemedicine. We built this, we built the lightweight EHR. We built all the telehealth components. We built all the data analytics components. And we, how can we reapply this? Like, what's another customer base or outside of this specific vertical that we can start to go after? And we made some slight modifications to the product. We made slight modifications. I want to say we started in the dermatology space. We did some work in the mental health space. We did some work in the pain management space for non-opiate alternatives. We moved around quite a bit, and we put stakes in the ground. We said, okay, if we're going, initially we were going through paid marketing channels. If the paid marketing direct to consumer effort works, we want to see a customer acquisition cost of, our CAC of $100. So what that means essentially is that the cost of us acquiring a customer through paid channels like Facebook, Instagram for these types of products and services direct to consumer, we have to hit $100 CAC, and we have to hit it in 3 months. We also explored ideas around reselling our solution to providers and enabling those providers to expand their practice and to use our solution to treat their own patients, as well as to really increase the capacity of their practice by leveraging these digital health technologies that we were using. So it's really about putting stakes in the ground and being disciplined about it, making sure that you're spending time strategizing with your team, that if those goals aren't met, if it's close enough, sometimes you'll say, okay, well, the CAC we reached is $115. There's definitely something here. So I'm going to keep chipping away, and I'm going to keep making the modifications to the product or service until it's below 100. There could be issues on the funnel, maybe something wrong with our advertising. So you just want to put a stake in the ground, and you have to be disciplined, but be loosely disciplined. Like if you do see a lot of signal from the market where people are showing a lot of interest and they're willing, in enterprise, it's easy. You say, okay, I want to see if I can get a customer to sign a contract within 6 months. If you're able to get a couple of customers who want your product, great. If not, my advice is go back to customer development. Don't be afraid to do it while you're even trying to push your existing product and service. Start to explore other pains and problems, because you may actually uncover a much bigger one than the one you embarked on solving in the first place. But be disciplined. Don't be afraid to continue doing customer development along the way, even with existing customers you're talking to. Again, I would follow that format first. And again, if you want to speak more directly, Akarsh, about this, I can give you some more specific examples, and I'm happy to take the time with you if you're dealing with those challenges right now regarding a product or service you yourself are working on.
Okay, great. We've got another question from Kelsey. Was it hard to give up on the idea of clinical medicine in your career? Was there any part of you that considered doing residency? And do you think it's possible to do something like this while practicing clinical medicine, or do you really have to pick one or the other?
I never admit this because I was always scared that my investors were, because again, I'd raised a seed round during my fourth year of med school for a company I was starting. And I actually, I put together, I did my whole ERAS application. I was considering doing emergency medicine still. And it was a very tough decision to pull that application, to pull out a match. And I pulled out a match like 2 weeks before. I'd spoken, I was really excited. I mean, you got to understand, the dream about wanting to be an emergency medicine doctor was a dream I had way before my ambitions as an entrepreneur. And so that continued to really chip away at me. And it was a very tough decision. Cliff, who's on the line, he saw me when I was going through that application process. He could probably recall some stories, but I was constantly going back and forth. It wasn't an easy answer one way or the other. Now, was there any part of me considered doing residency even after that? Yes. I'm telling you, I'm not going to lie. When times have gotten really tough, and I've, again, even though I like to think I'm far more resilient than I was 7 years ago, there have been times over the past year and a half where I've literally sat there and pondered, did I make the right decision? Should I be considering residency? I may have gone on a couple of websites, reached out to other individuals just to maintain those relationships. And again, Parsible has been a very successful company. And just because you have one successful company, starting another one doesn't make it any easier. It makes raising capital a lot easier, but finding product market fit does not discriminate. It doesn't care if you started it. You could build $1 billion company previously. My friend Z from Rowe had started many failed companies before the success of Roman, which is now $1 billion plus company. He has tasted failure. I wasn't used to tasting it to the same extent as a failed company. So I have thought about it. I had thought about it quite a bit. I mean, I'm pretty dedicated. I'd like to think I'm very dedicated, 90% plus dedicated to the path that I'm on, but that thought has entered the mind. Do I think it's possible to practice clinical medicine in combining it? Absolutely, yes. You can definitely combine a career in clinical medicine with entrepreneurship. Right now, digital health, I'm not just saying this, look at the market, look at what's happening both on the private market side or even on the public side. There is insane demand for digital health right now. As I like to think we're finally in the digital health era. It never really had the spotlight it does today. And so these companies are looking for people to advise. These companies are looking for chief medical officers, CMIOs. They're looking for individuals that they want you to continue practicing medicine, because that provides a lot more credibility to the company. And at the same time, the experience you're gaining in the clinical world can translate in so many ways to what you're building as a company. So absolutely yes. Now, it depends on the role you're playing. If you're taking on more of a business role at the company, you're the CEO, it makes it a lot more challenging, because again, there's so much time and dedication you're having to provide to that company. But if you're super excited and you're passionate and you feel this natural pull to becoming a practicing physician, you should go and do it. And don't feel like you're leaving opportunities on the table, because there will always be opportunities on the table for people like you in the world of early stage investing, entrepreneurship, or just generally in the world of business.
Where would you even direct?
I was just going to say one thing. The pandemic has accelerated that, right? Because we've learned new ways of practicing medicine, whether it's telehealth. We have a project now. I don't know if all the students have heard about it, called the Warrior Watch, that Zahi Fayed is leading, where we're monitoring heart rate variability through one of the Apple Watches. So it's exploding now because we had no other choice given the pandemic. So there's lots of opportunities there.
Most definitely. And again, another good friend of mine is you guys, everyone, we've all, I like to think most of us have used his solution for studying for the boards. Andrew, he's the founder of Sketchy Medical. So he just left. I mean, he's no longer emergent. He's no longer an emergency. I mean, he did very well for himself. I'll just say that. Sorry, Andrew, you ever see this video, but everyone now knows you did well. He actually just recently left Northwestern as an emergency medicine doctor. He was practicing, by the way. He was going through residency. He was practicing as an attending at Northwestern University, all throughout the time that he built Sketchy Micro, Sketchy Farm, etc. And he recently just left because, again, he's wanting to act and he's wanting to be a CEO and build his own company. So, and he's wanting to provide 100% time and dedication to that. So yes, he has left, but he was able to do it while in residency. It's very hard, but with the right co-founders, it's definitely possible.
So Chase, for the students that maybe just want to dabble or try it out, they're not quite in this world yet, where would you recommend that they even start looking for like those positions you were talking about for like advisings and stuff like that?
Yeah. So first of all, there's been, there's a number of platforms. Sherman, you created something to help. Sherman helped create. I keep bringing up Sherman because I see Sherman on here, and I know he's in VC and he's deep in this world, and he's working with some good people. He's working with Brenton Fargnoli and others at a really good fund in New York. You developed a platform that helps medical students pair up, right?
That's right. I can talk a little bit about it if you'll let me.
Yeah.
It's called MD++, and I could share the link in the chat, but it's precisely, what I think Kelsey was asking about, like for folks that have dual interest in startups, entrepreneurship, venture, business, how do we combine kind of these maybe non-clinical interests with our clinical interests? And it's meant for folks that, want to do both, or at least are really authentically exploring both. I myself, waffle, just like you, Chase, do I want to go to residency, really become a clinician? Can I combine it with the other interests that I have before medical school? But no, we'd love to encourage everybody on this call that's grappling with the same tension to join this group, because it's a lot of us working through it at a number of different medical schools. We're 500 medical students large now across all the country, and a lot of like-minded folks here. Thanks, Chase.
Yeah. Of course, and so Sherman's been doing a lot of good work in the space around helping medical students find find opportunities like this. My advice is, again, if any of you are interested in any opportunities in the early stage side, and you don't have an idea, you don't know what you want to work on. So actually, I did this with a former Sinai student. He ended up doing and pursuing it full time, and he's now the CEO of a company, and we built this company around him. He's raised over $12 million to date. And I've been coaching him and helping him. And he was the first time he'd never done it before. It was his first time working as an entrepreneur. And I've spent, hundreds of hours with him, coaching him, advising him. For any of you that are interested in opportunities, you don't know if you want to jump in, you may want to advise, you may have some special interests and take on some part-time role at an early stage company. Please don't hesitate to reach out to me directly. I'm always, again, you have no idea. I'm not just saying this because Dean Charney is on here. I would say it even if he wasn't on here, or if we weren't even being recorded, I'd still say it too. So I just want to make that known. Seriously, I can't tell you how incredible the Mount Sinai ecosystem has been. To me, even folks outside of the field, folks like I made very close friends, folks like Joel Dudley, who I was texting with early all day today. You meet incredible people along your way and along your journey that will really have a great impact on you. And so again, I want to do the same for any of you that are interested in even thinking about and pondering different opportunities. I'm more than happy to, and I'm always available to get on the phone and chat.
So, I know Chase means that. So don't hesitate to reach out to him. And you should also feel free to reach out to me, because we want you to be thinking out of the box and push the envelope. So if you have a passion for something and you're wondering, can the school help you, support you in some way? The answer would be yes. So, don't be shy in reaching out to me. And I would also, add, even once you become a faculty member, and many of you will become faculty members, you can still form companies and be entrepreneurial. For example, Mount Sinai has formed multiple companies in the last year. Barbara Murphy, chair of medicine. We just spun out a company based on her work. Marlu Dubinsky, who runs the pediatric IBD program. We just formed a company out of her work that she's very involved in. So at any step of the way, med student, resident, faculty member, you can still become an entrepreneur and change medicine. Or you can go, the route that, Chase has been doing. And you never know, he may come back and say, I want to be a resident. We'll see.
Hey, if I come knocking on any of your doors in the future, please answer. I may need a job.
Okay. So, Alexis, do you want to wrap up at this point? I think we're out of time, right? 6 o'clock?
Yeah. Chase, I may be calling you for advice too.
Of course.
So that's perfect. I think perfect timing. No more questions. Thank you so much for taking the time out. This is really, really informative. And so I think we are good to go.
Excellent. Thank you so much again, everybody. Again, I'm going to message my personal information, my cell, as well as my email here. For any of you guys that want to get in touch, please don't hesitate. That's oops, I just sent it to you, Sherman. My bad. I meant to send to everybody. So here we go. My cell, and then also my my email address. I mean it sincerely. If you guys want to reach out. Text me, call me. If I'm in a meeting, I won't answer, but I will call you back, and I will make myself available to any Mount Sinai student. And again, if for any of you that are even thinking about it, please reach out.
Everybody take care. Be safe.
Thanks, everybody. Thanks, Dean Charney. Thank you, Dr. Coleman. Thank you, everybody. Thank you, Rashma.